Hello everybody, my name is John Clifton Tricou. I'm a radiologist here at Iroquois Memorial Hospital, and I was hoping to get a chance to talk to you about a couple of topics today. The first one would be screening mammography, and a big question that a lot of people have is when to start and how often to do it, and as to what screening mammography is. Screening mammography is where we take the basic 4 different projections of the breasts, 2 for each breast, one in what we call the MLO projection, and one in what we call the CC projection. Those images allow us to get a really good detailed look at what's inside the breast. We recommend that this remains the standard of choice for looking at the breast. There are a whole bunch of other types of research being done out there, but this is the only one that's been proven really to be effective across the board. What we do is basically we go ahead and have everybody get in here every once a year, starting at age 40, to be able to get a mammogram. The idea of doing it once a year is to try to catch anything while it's still small. The idea of doing it at age 40 is that that's the time period that we start seeing an increase in the risk of getting breast cancer. There are a few people that it might be worthwhile to do it under age 40, and it's usually the people with a very high risk, either because they have sisters or mothers or even daughters who've had breast cancer and need to be considered in a higher risk category. I would talk to your doctor about whether or not that applies to you. There's also what they call the BRCA gene, which runs in some families and also makes you at an increased risk. But if we can do mammography every year, we can catch things small, hopefully smaller than the size of your pinky fingernail. If we catch it that small, the likelihood of having anything leave the breast to other parts of the body becomes very low. So again, mammography screening starts at about age 40 and should probably be done every year until the end of your life. There is some discussion and changes that are going on with that, and there's some patients that if they are sick enough that they don't expect to live another 5 years, then they probably don't need to be screened anymore. But that's a very small subset of the population. So the next topic I was going to talk about today was what's called diagnostic mammography. Diagnostic mammography is actually for a different type of purpose. It's for those people not with no symptoms, but those actually presenting with complaints. Either it's people who have developed a lump in the breast, sometimes certain types of discharges from the nipple, either bloody or greenish discharges from the nipple can be an issue, or skin changes, either dimpling of the skin where the skin gets pulled in a little bit, sometimes a bulge of the skin, and then there's also one that's kind of like the skin of an orange, what they call the peau d'orange. Those types of symptoms are all concerning. Those can be a higher risk of getting actually a breast cancer. So for those patients, irregardless of their age, generally after age about 25, they should come in and get evaluated by their doctor. Physical examination is being a big part of that. And then also, they should take the opportunity to get evaluated with either mammography or ultrasound. Ultrasound is used as an adjunct to mammography. We generally don't do ultrasound first, except for a very small population under age 30. Generally, mammography is still the standard of choice for that. Here are the advantages. You're still catching something relatively early if you can catch it early enough. The disadvantage is that it had to wait to the point where you already were detecting it clinically. So again, if you have developed something new and you need to talk to your doctor, and then they need to put you in the right protocol to figure out what's going on. On those cases, we go sometimes beyond just the 2 views that we do of the breasts. We sometimes do additional mammogram images, and you may also see me or my colleague coming in to see you and say hello and see what's going on, and sometimes feel the lesion itself. So if you have developed a symptom, you need to go ahead and do something about it. Thank you.